Hi, I'm Elle Wadsworth and I'm a PhD student.
Hi, I'm Dave Hammond, a professor in the School of Public Health at the University of Waterloo.
On October the 17th, 2018, non-medical cannabis will be legalized in Canada, only the second country in the world to do so. In order to capture the Canadian policy experience, we have interviewed many stakeholders across the country prior to legalization.
The series will cover how cannabis will be regulated, changes in the cannabis industry, and why Canada legalized cannabis in the first place.
Medical cannabis is cannabis that has been prescribed by a attending physician or a prescriber, so whether a medical doctor or a nurse practitioner, who has done a intake for somebody's condition and determined based on their comfort level and their assessment of the therapeutic effects that medical cannabis will help with certain ailments. MedRelief right now is a vertically integrated cannabis company that strictly produces medical cannabis. Patients will receive their medical document and create a one-to-one relationship with a licensed producer, of which MedRelief is one. Once they've got that relationship established, access to the store opens up and they purchase directly from us, whether on the phone, online, or talking to our award-winning patient care team. And they can purchase cannabis in dried flower format. We have a license to create cannabis oil so take the extract from the flower. And we also have a license to turn that oil into capsules for metered dosing to allow for specific like metered dose to deal with certain elements. So that is our business model right now. That's obviously going to be changing once the Cannabis Act receives royal assent.
So the medical cannabis market has taught us many things, particularly in terms of the supply of cannabis material. We are now in a position where the government knows how to regulate the cultivation, production and distribution of cannabis through a fairly robust retail system. It's online and it's effectively direct to consumer at the moment. But at least the experience with licensing companies to source cannabis materials, cultivate it, store it, test it, distribute it has been validated. I mean, there are 95 companies at the moment who are licensed to cultivate and cannabis for medical purposes. Thousands of kilograms being grown and shipped, huge expansions underway to try to meet the recreational market. So I think this industry has grown up under a medical program. It has had its teething problems with respect to testing and how do we ensure that products are tested safely, that they're grown safely. And I think with product recalls, there's an element of exploration about what's acceptable, what isn't. So I think that's probably been one of the strongest lessons from a medical supply framework that's being translated into the non-medical framework. I think the other thing that the medical framework has done is it's begun to allow people to talk about cannabis in a way that is not just a drug of abuse or an illicit substance, that it may have this medicinally effective or medicinally useful property, whether it be for pain or spasticity or appetite or nausea. And I think slowly the medical community has begun to look at cannabis in a slightly different way. There's still a huge shortage of data to support many of the claims that patients are making, and I think that's going to be an important challenge to face in the next few years. But there's certainly been a rethinking of cannabis through the medical lens as something other than just a drug with no medical benefits that's dangerous. And I think that that's also been something that we can look back over the last 20 years of medical framework and say that at least the conversation has evolved. Probably the loudest source of concern from the medical cannabis community around the implementation of a legal non-medical framework is the fact that patients who have a bona fide medical need for cannabis in some form to alleviate or to treat their symptoms are going to get forgotten or neglected in this new shiny regulatory framework for non-medical use. I think that for a lot of patients, and we heard in the task force from patients specifically, that they're not using cannabis because it's fun, because they're enjoying and choosing to use it. They're using it because they have found that this is the only thing that helps and can help with some very severe and very debilitating conditions. So they were worried, and in order for them to access cannabis up until the implementation of a new legal framework was through their physician or their health provider. So they received a special authorization, they received it as a medicine, it was in a clinical context, and there was concern that if it was simply a legal non-medical market and the medical supply was eliminated, that they would no longer have to speak to their doctor or health provider. They would have to go and buy it like everybody else at the shop, and it would lose that context where it's being handled and treated and monitored as a medication. And I think that was quite a surprise, was how precious they were about the medical conception of cannabis in their lives. I think there was some concern that if it's legal and non-medical, that there would be a stampede away from supplying medical patients, and that would include products that are probably of more interest to the medical community than they are to the non-medical community. And I'm specifically referring here to cannabidiol, CBD products, which don't have much euphoric or psychoactive potential, and so are unlikely to be of much interest to a non-medical user, but which can be tremendously valuable for some people who are using it purely for medical purposes. So there was a bit of a concern that product availabilities would shift away from what medical patients need just to feed the recreational market. And with that comes a transfer of interest in funding studies to look at medical use. If all the money is to be made on the recreational side, why fund research on medical cannabis or medical cannabinoids?
I think that's kind of that's one of the issues I've had with the legalization effort that the government has put forward. So there's been a lot of uncertainty around medical cannabis in a recreational environment. Our strategic objective at MedRelief is to ensure that we're going full steam ahead with a medical cannabis arm and a recreational cannabis arm. There are two very different needs for the product. One of them has obviously had a demonstrated case already in the medical cannabis market. Recreational will be a different story altogether that I think everybody will sort of learn as they go, but that idea that there won't be a medical cannabis company or a medical cannabis market is one I'd push back on. The access to cannabis for medical purposes regulations are going to be folded into the Cannabis Act. So, the government has stated that 5 years from royal assent, they're going to reassess the medical market, but for at least the next 5 years, there is a distinct medical cannabis use case and recreational cannabis use case. Where the uncertainty has come up is what exactly is the difference between the two. We at MedRelief have our ideas about how we're going to segment that market and make sure that we're offering products that speak to both consumers.
So I feel, and this might be more of a personal opinion, I feel that there's a very blurred line in between medical and recreational. Even though we wouldn't be considered medical, we're still using that knowledge from that recreational space to funnel back into that medical need. And that's the thing. There's no one side or the other. It's all connected. What we'll notice, especially with the end user and consumer, is that everybody's going to start off recreationally, but they'll go into a flow where they'll say, okay, I use cannabis for this, which essentially becomes medical.
Who's to say that CBD oil, which is commonly something that many people will say is a very strong medical application of cannabis, who's to say that's not going to be a hit in the recreational market? I've got some high-stress parents who have heretofore sworn off the idea of partaking in any sort of cannabis product, who would probably benefit greatly from having a little bit of de-stressing based on CBD oil. But is that going to be a medical thing? Is that going to be a recreational product? Should they be medical cannabis patients? These are parts of the sort of legislative framework that are vague, and I think the market will shake out in terms of how the two sort of individual channels continue to coexist. after C45 comes online.